Hi, I'm Laura, this is Craig, and this is Kristen. We're student physical therapists at the University of St. Augustine, and today we're going to show you how to do passive range of motion for persons with ALS. Passive range of motion is incredibly beneficial because it helps maintain the flexibility of the joints, increases health and relaxation for the person with ALS. It also helps to decrease pain levels. If passive range of motion is not performed, it allows the joints to tighten up. For example, at the ankles, if they tighten up, then during transfers, the person with ALS will be on their toes, which increases the weight load of the caregiver and decreases stability, which can aid in falls. Passive range of motion is done by a caregiver taking the limb through its normal range of motion, stopping when you feel resistance. If this causes any pain for the person with ALS, then you want to back off and not go as far on your next repetition. Passive range of motion can be done as a whole, or you can break them up into 2 to 3 sessions a day for time management. Just make sure that you do 5 to 10 repetitions of each motion. And we're going to begin passive range of motion in the bed.
To begin with, we have Martin, who is a person living with ALS, who has volunteered to be in our demo. We are going to begin with range of motions at the shoulder. And to get started, we need to move the pillows out of the way. Next, we are going to turn the thumb up towards the sky, and we're going to begin by slowly raising the arm towards the shoulder. Now, notice Martin has some stiffness in his shoulder, and so Craig is going to stop as soon as he feels resistance. If you are not feeling this resistance, you can continue up until you do feel that resistance. Then you're going to slowly lower back down. You are ideally going to repeat this 5 to 10 times. A good way to get this into your day is during bathing, when washing under the arm, take the arm through this range of motion a couple times. Next, we are going to bring the arm up towards the head. You can do this with the arm straight or bent. And again, notice Martin has some stiffness. If you are not feeling this, you can continue up higher. Note Craig's hands. One is under the elbow and one is right at the wrist. During this and the previous motion, you want to make sure that your back is nice and straight, not rounded over. And if you are standing, you can shift your weight between your legs. Depending on the height of your bed, you can sit on the bed or stand next to it. Note how Craig shifts his weight between his front and back legs. Next, we are going to rotate the arm. You're going to bring the back of the hand towards the floor, and then the palm towards the bed. Again, if you don't notice any stiffness, you can continue till where you do feel resistance. You just want to continue until you feel resistance, or until you see the shoulder start to pop up. Moving on to the elbow, you are just going to straighten the arm out and then bend it. You want to make sure that you can go as straight as you can, because this motion is one that has a tendency to become tight and then can interfere with transfers and your activities of daily living. Note how Craig shifts his weight between his front and back legs and keeps his back nice and straight. If your bed is low, you can do this from sitting on the bed, again making sure that your back is straight. Next, we are going to work on rotating the forearm, and you can just put your hand on each side of the person's arm, and you are going to turn slowly in each direction until you feel this stiffness. Moving on to the wrist, you are going to do the same thing as the elbow and just bend the wrist forward and back. Again, making sure that you are bending at your waist and not at your back. You can do this sitting on the bed or standing next to it. Then working on the fingers, you just want to take all the fingers together and straighten and bend them. The move of straightening them is another area in which the muscles tend to become tight, where it is very important that you want to do this. So with any of the ones that become tight, if you don't have a lot of time in your day, these are some key muscles that you make sure you want to get in. After the fingers, you also want to make sure to include the thumb, doing the same thing, just bending it towards the palm and then away, each time going only until you feel resistance. Next, we're going to move on to the bottom half of the body, starting at the hip. To begin at the hip, you are going to place one hand underneath the knee and one hand underneath the ankle and slowly bring the knee up towards the face. During this, you are going to watch and listen for any signs of discomfort. You are going to go just until you feel resistance and then slowly lower back to the bed. For this and every other motion, you want to aim for 5 to 10 repetitions. Another way to do this hip range of motion is to lift the leg straight up to the sky with one hand just above the knee and one just behind the ankle. During this, you want to keep your back nice and straight, only shifting your weight between your legs. You can have one knee up on the bed if this helps you to get closer and keep this back position. You also want to make sure that all of your fingers and your thumb are together and the weight of the leg is not resting solely on your thumb. Next, we are going to bring the hip up to 90 degrees and bend the knee. You can also do this with the leg straight, however that is more difficult. And you are just going to slowly lower the leg down towards the table until you feel resistance, making sure that you are just bending your legs and not bending your back, and then return back up towards the ceiling and cross over the other direction until you feel resistance. Again, you want to try to get in 5 to 10 reps of these. While in this position, you can also just perform small circles with the leg bent at 90. During this, you want to make sure that the circles are coming from your legs and not from your back. Next, we are going to do some range of motion at the knee. It is very important to make sure that you do these motions. If you are short on time, these are one motions to not cut from your routine. First, you're going to start by bringing the heel up towards the bottom. If you encounter spasticity, what you want to do is continue a slow movement and hold in this position. On your next repetition, you want to make sure to go very slowly as to not trigger this again. An increase in this spasticity is also another sign of discomfort. While doing this motion, you want to try to move from your legs and shift between your front and back legs. If your bed is too high or too low, you can come up onto the bed with one knee and perform this motion. To begin at the ankle, notice the initial starting position of the foot in a downward direction. This is an area that is prone to becoming very tight, and if it does, this can interfere with transfers. Therefore, in your day, you want to spend a couple extra minutes working on this area. One way to do this is to place one hand behind the foot and the other hand just around the top of the foot and bring the toes back towards the face. You can also do this by placing your hand around the heel and the foot on your forearm and pushing straight up towards the face. This motion should also be performed with the knee bent, with the same hand position of the hand cupping the heel and the foot resting on the forearm, and slowly bring the toes up towards the face. If you notice a rhythmical beat of the foot, stop what you're doing, remove your hand from under the heel, and place your hand on top of the foot and pull the toes back towards the face. For this position and the previous position, a stretch can be held of 30 seconds in each position and relax. Range of motion of the toes can be performed by bending the toes down towards the sole of the foot and then bringing them back up towards the face. These are another area of the body that are particularly prone to becoming tight and therefore can involve difficulty with transfers. So if you do have difficulty fitting these into your day, these are another area that you want to make sure you work on. You can also fit these into your day when putting on shoes and socks. A final movement of the ankle is turning it in and out. However, if time is limited in your day, this is one area that you can skip. Again, you want to make sure that your back is nice and straight and you are bending forward at your hips. We have now completed range of motion on one side of the body. Ideally, you want to do both sides of the body every day. However, depending on your situation, you may have to make a couple changes and do one side of the body one day and one side of the body the next day. If you are in a single bed, you can just walk around to the other side of the bed and complete the motion on the other side of the body. If you have a larger than single bed, you have a couple options. One option is to come up onto the bed and perform ranges of motion just on the shoulder. You can also have the person sleep at the head of the bed one day, performing range of motion on one side, and on the next night, sleep on the other side with their head at the foot of the bed, performing range of motion on the opposite side. Another option is to just shift the patient between the right and left sides of the bed so that you may perform range of motion on one side one day, and on the next day, sleep on the opposite side of the bed, being the left side, and perform range of motion.
To begin passive range in the chair, we're going to start at the shoulder with flexion. This can be done with the elbow either straight or bent, depending on your preference. Just make sure that the arm is not rotated in towards the body or away from it. Support the upper arm above the elbow and then the lower arm above the wrist. Move to the point of resistance and then stop. As you can see, there are some restrictions, so if you do not feel resistance at this point, continue on in your range. Repeat this 5 to 10 times and then move on. The next movement, place the arm in line with the body and then lift it up towards the ear. This is another easy one to work into your day during shower time while washing the side of the body. Just do the motion a few times while there. Bringing the arm across the body, stop and move until you feel resistance, and then return back to normal. Do this 5 to 10 times, remembering to shift your weight through your legs, not bending at your back. To work on shoulder rotation, bring the arm back towards the body, support it under the elbow, and then move the hand in towards the body and away from the body. Do this 5 to 10 times, and remember to listen or look for signs of discomfort. All of the motions we've just shown you are very important to do on a daily basis to prevent frozen shoulder. Moving on to the elbow, you want to support the arm and bring the hand up towards the face, and then back down. Straightening the elbow is very important to do daily, as this muscle is prone to spasticity. Another motion to do is to grasp around the wrist and turn the palm up and then back down. Remember to do this 5 to 10 times and look for signs of discomfort. When working with the wrist, remember to support the forearm and the hand on both sides. Bend the wrist down towards the floor and then bring back up. Do this 5 to 10 times. And then move on to the fingers. Curl all of the fingers in towards the palm and then straighten back out. Make sure that you don't press the fingers in too hard on the palm, and always try to straighten the fingers out as much as possible because this tends to get tight. After you've done this, don't forget to do the same thing with the thumb. curling it in towards the palm and then straightening back out. If you notice that the hand is tight, you can also arrange each finger individually. You do this by curling each finger in by itself and then straightening it back out. As a reminder, passive range of motion is done for relaxation, so remind the person throughout the experience to try and relax as much as possible. A good technique that feels very comfortable for the person is to do hand glides, where you wiggle each knuckle up and down.
Okay, now we are going to demonstrate passive range of motion in the wheelchair. When you move from the bed to the wheelchair, there's a few limitations. You will not be able to bring the lower extremity through as many motions as you did in the bed. We're going to begin with the hip, with the rotation of the hip, moving the foot in and then out. Okay, just as in the bed, you can perform this 5 to 10 times, moving the foot out and moving the foot back in. And that is the only motion at the hip that you can perform in the wheelchair. Moving on to the knee, bending and straightening the knee, always remembering to go slow and smooth.